Hi, my name is Ramesh Singha. I'm an interventional pain anesthesia-trained physician, and I work at Republic Spine Pain out of the Spicewood Surgery Center in Austin, Texas. Patients with SI joint dysfunction will come into the clinic and they'll describe having low back pain that's worsened when getting out of the car, so that's swinging their leg out of the car, or rolling in bed, so they're swinging their leg over to get out of bed, or simply a simple motion of just standing in front of the sink and bending forward a little bit can also elicit that back pain. When a patient comes in with what we suspect is sacroiliac joint pain or dysfunction, we are first, of course, getting a history of low back pain and in relationship to them either putting their sock on or their shoe on, twisting in bed, or getting out of the car. Once we get that kind of history, we do an exam. There are certain maneuvers that we do in order to assess the sacroiliac joint function or perhaps arthritis in the joint, and usually that involves what's called either a Patrick's test or a Foten's finger test or even a Ganson's test, which are all provocative maneuvers to establish a sacroiliac joint dysfunction diagnosis. From there, what we usually will do is go down the pathway of what will get them the best outcome. So first and foremost, I'll be assessing their physical therapy engagement. If they're not engaged in physical therapy, I'll refer them specifically for sacroiliac joint strengthening, which for me is much different than other strengthening exercises. I'll also advise to get a sacroiliac joint belt for patients who could use that extra tool in their tool belt. And of course, diagnostic tests that we do procedurally are things like sacroiliac joint injections, which include diagnostic injections that use just a local anesthetic or those that involve steroid as well.